Rebecca, let's begin with the latest numbers. I know over the weekend, the sharpest rise in a 24-hour period recorded there.
Yes, that's right. It's really another grim milestone for India because it's now overtaken Russia to become the third worst hit country globally in terms of those number of confirmed infections. There are some 700,000 confirmed infections in total for India now. So that's really a worrying figure. And what's really worrying is these numbers are continuing to rise, having seen that record daily spike over the weekend and these continuous record daily spikes, it seems, as infections continue to surge across the country. Now, the government has said that one of the main factors when we're seeing these rises in cases, it has to be considered that India has dramatically increased the amount of testing it's doing. Delhi, for example, has tripled the number of COVID-19 tests it's doing. So that is perhaps a significant factor in the numbers. But there's also the fact that India has opened up quite significantly in recent weeks because of the economic impact of the nationwide lockdown, which came into effect on March the 25th. It really hit people very hard. Businesses, the poor, many migrants left the big cities. They were left without work and returned to their home villages. Some of them even dying along the way as they walked hundreds of kilometres. So the economic impact really was grim. So in June, the government at a central level did really decide to allow a lot of relaxations to come into effect. And then it was up to the state governments individually to decide which relaxations they would actually go ahead with. So, for example, Delhi actually allowed its restaurants and shopping malls and places of worship to open up. But Mumbai, which was at that point the worst affected city, now it having been overtaken by Delhi more recently, but at that point Mumbai was the worst affected city, and it decided in the state of Maharashtra, where it's located, the state government here decided not to allow those relaxations. So there's really been a lot of differences across the different states, but certainly these relaxations are considered to be a huge factor, according to medical experts, in the rise in number of infections.
And I think I suspect I missed those numbers up slightly, Rebecca, going into our conversation, because it was about 25,000 new infections recorded over the weekend in a 24-hour period, over 600 deaths. I want to talk to you about something else. Forecasts that at the rate that things are going, because you mentioned Delhi, the worry there is that Delhi could reach, what, 500,000 infections by the end of the month. Is that right?
That's absolutely correct. That's a comment that actually came out from the Delhi state government there, that they were talking about the possibility of 500,000 cases, which is pretty incredible. And really the real problem has been in cities including Delhi and Mumbai, also Bangalore, for example, as well in Karnataka, where they're seeing a large number of cases in South India. It's the strain on the health infrastructure. Now, this was always going to be a problem for India. India's public health care infrastructure was already very overstretched even before the coronavirus pandemic. And India does have a relatively low ratio of doctors and hospital beds to patients. So this means it's been a real struggle for hospitals to cope with these new numbers of infections that keep coming through every day. We've seen a lot of reports over the past few weeks and even over the weekend of people actually being turned away from several hospitals and actually dying as a result. So this is really the tragic consequence of that. Now, there have been efforts by authorities to try to improve the situation and make sure people can get access to the healthcare they need. So, for example, in Delhi, they've just built a 10,000-bed COVID-19 facility. It's a vast facility with these kind of disposable beds that have been built, and that's really one of the big efforts to try to accommodate patients. In Mumbai, we've seen similar measures taking place. They've opened up temporary field hospitals in one of the main business districts in the city, and opened up quarantine facilities across different sites in the city as well, at iconic locations, as they try to really cope with these high numbers of cases in India.
Rebecca Bandan live for us in Mumbai, India. Thank you for that update.